Hey, everybody, welcome back to the Energy MD podcast, where we help you resolve your chronic fatigue, long COVID, and MCAS so that you can live a life that you are happy about, that you really deserve. So, really excited about today's talk because we're going to be talking a little bit about stress, a little bit about things that you can do for your brain that you in order to mitigate stress, a little bit about burnout. So, pay attention. We're going to be talking with Dr. Romie Mushtaq, and so let's learn a little bit about her. So she is a board-certified physician who brings together more than 2 decades of leadership in neurology, integrative medicine, and mindfulness. She is an award-winning speaker working with Fortune 500 companies, professional athletes, and global associations. Her brainSHIFT programs improve mental well-being and help to build a culture of wellness. Dr. Romie served as Chief Wellness Officer for Evolution Hospitality, where she scaled a mindfulness and wellness program to over 7,000 employees. Her expertise is featured in the national media such as NPR, NBC, TED Talks, and Forbes. Her first book, The Busy Brain Cure, is out and a USA Today bestseller. Woot woot. Dr. Romie, thank you so much for joining me today.
Dr. Hirsch, it's an honor truly to sit with you as someone that has been alongside doing the work for patients and colleagues dealing with chronic fatigue and chronic disease. I've sent many clients your way, and really an honor to sit down with a like-minded colleague. So thank you.
And thank you. Yeah, I'm really excited about picking your brain today and sharing your knowledge with our audience. I think they're going to get a lot out of it. So let's talk a little bit about what caused this transition for you. You know, you were coming from integrative medicine, a traditional medicine practice initially, and then now you're into stress management, doing all these wonderful things. How did that happen for you?
Yeah. Evan, it's so easy to look back now and give you and the audience 2 to 3 talking points, but I start with this to say, I humbly come to you not only because of my credentials, but because I had to journey through my mess to help your listeners heal theirs, really from a humble place. I was one of the first people to come out on the TED Talk stage, giving TED Talks and talk about having a mental health crisis and burnout that
Mm,
resulted in my life-saving surgery and made me think about what are we doing in the workplace is wrong, not only in healthcare, but globally. And, this was a decade ago now. This was 2014, and it caught the attention of corporate America, forward-thinking corporate culture. So a lot of people may be raising their eyebrows just like you did and thinking, "What? Corporate America?" But absolutely. I was getting called to teach mindfulness and meditation to professional athletes, corporate clients, and then I started to listen and I thought, the symptoms that I was having before I got sick and burned out, difficulty focusing, feeling anxious
mm,
all day, jacked up on caffeine or stimulants, needing wine or something to calm me down at night. Like this, I'm hearing this over and over. And clients were saying, "Well, thank you for teaching us about meditation mindfulness, but there's still something going on with my brain." And the doctor researcher in me started to put 2 and 2 together in something we'll talk about in a second, busy brain. And I'm so blessed because we have so many corporate clients that when I want to go out and do research, I can field test this in what I say a realistic setting because clinical trials, as you know, are often, really done in a clinical setting. And maybe people say, does this translate to real world? Well, I was working with thousands of executives across all industries researching this. And here we are today with the busy brain cure. And I still say this is I remember what it was like to walk the hospital corridors. And on the outside, people thought I had made it. I'm a doctor, I'm a professor, I'm a researcher. I entered neurology at a time where less than 5% of the brain doctors in the US are women. And still I was suffering. And, Evan, nobody asked me if I was okay.
mm.
And my patients, but not any colleagues. And it's a really dark and lonely feeling. And I just thought, maybe if you have me on your podcast and anybody is listening and they feel like they're in a dark place and they can't explain it and they feel alone, well, maybe today they'll remember from you and I that they're not alone and we have a path forward for them.
Mhm. Well said. So what do you think it was, what do you think it is about our culture where, people weren't asking how you were or, kind of like this tough it out culture, or,
Mhm.
where do you think that comes from, and why is that so dangerous?
Think certain corporate cultures, and that it even exists today in medicine, for example, this authoritarian type of mentality, never let them see you sweat. You have to wear an emotional armor on as well as a physical armor at work. And talking about anything related to your personal well being or personal life can be seen as a weakness.
Hmm.
And unfortunately, there are still systems that are like that today, though I really applaud uh, social media and our millennial and Gen Z colleagues that are normalizing talking about mental health. Then the pandemic happened, and the mental health crisis that you and I, as doctors, know existed for over a decade was just wildly exposed. But yet today, we've lost any semblance of a boundary between our home and our personal lives, always this FOMO of being plugged into work. And most high achieving professionals I work with are just saying they're working at peak performance at the edge of burnout, almost like with pride, like wearing stress or burnout as a badge of honor, or feeling resigned that like I don't know how to do anything differently. And I'm a single parent and I have to pay my mortgage. And so I have no choice but to put in these long hours. And I think that's what's happened, a combination of attitudes in the workplace, the attitude in the Western cultures, and this inability to unplug from work.
Yeah, and you throw in the news and what's
Hmm.
happening in the world,
Yeah.
and it's all
Social
just
media.
right.
Yeah. The compare and despair attitudes of social media, whether you're thinking about your appearance or you're thinking about comparing yourself to somebody else's marriage as they portray it on social media, it creates suffering. And we
Hmm.
feel that we are out of control, my brain is out of control, and the world is out of control. And I'm here to say there's a different path.
Brilliant. Yeah, I'm excited to get into that. Yeah, it seems like for, in society, it seems like everywhere that you turn, you have the potential to end up with self-loathing and suffering, just from the nature of all the things that we're exposed to. And it's no wonder that there's so much mental health also in our young people, and that's for a variety of different reasons. But let's get into the busy brain. What does it mean to have a busy brain?
Mhm. So, we just talked about a little bit about the busyness of the outside world, and that's not what a busy brain is about. What I was finding was our pre pandemic advice we would give for stress management or burnout is outdated and no longer effective. And that a lot of those things were about acute stress management. And quite bluntly, nobody listening to this podcast or reading the book wants to be told, eat berries, breathe, and take another emotional resilience class. That is no longer relevant. And what I found in my research, so, we'll put it in the show notes, but we had 17,000 adults take the busy brain test. It's a neuropsychology test, 20 minutes, 20 questions in 4 minutes. And it gave us this idea of what was chronic stress doing to people's brain and physical health. And it turns out that there's a specific pattern of neuroinflammation or inflammation in the brain that causes a triad of three symptoms: adult onset ADHD, anxiety, specifically ruminating anxiety, and insomnia. And that we colleagues in neurology and psychiatry and psychology got it wrong. Because in today's world, what happens? In order to survive and be at peak performance, people are taking excessive amount of caffeine all day to get energy. You talk about this often on your podcast and in your community. And then you're anxious and revved up. And then you think, I need to take the edge off when you go home, or you finally can come out of your home office at work and you need a glass of wine or three to calm down. And if that stops working, you go to a doctor who will prescribe, and we overprescribe stimulant medications to adults in the United States, like Adderall and Vyvanse. And then you're anxious all day, and then you get put on an anti-anxiety medication or a sleeping pill at night. I call that the stimulant sedative cycle. You need a
Mhm.
stimulant to be energized all day, and you need some kind of sedative to knock yourself out and rest at night. And that's what a busy brain is. And it will the neuroinflammation and that chronic stress will cause physical disease, and the stress can kill you. It almost killed me. I ended up in life-saving surgery in 2010. And that's where I had this wake-up call that I'm here for your listeners with their wake-up call, that there's a way out of this. And I'm not saying all stimulants are bad, but there's an overprescribing or overuse of caffeine and stimulants in the West.
And so, well, let's talk about then productivity. So
Mhm.
oftentimes people are taking these stimulants to be productive.
Mhm.
Does that end up, does that equation work?
It's not that simple. So, what we know is if you are not chronically stressed out and you're in a healthy state, a little bit of a caffeine in the morning absolutely will help focus, binding to the adenosine receptors. And you've had other guests on here talking about that. There's ideal times to take caffeine depending on, what your morning state is and your intermittent fasting protocols, et cetera. I won't get into that. But when you have a busy brain, so if you take the test for free and you score above a 30, you now have that pattern of neuroinflammation. And the higher the score, the worse it is. So, what we know is that you might temporarily feel a temporary boost from the caffeine, but all you're doing, especially if you're adding sugar with it, a high glycemic carbohydrate, is that you're now actually fueling the network that fuels inattentiveness, uh, the DMN network. And you're fueling like the inability to focus and not pay attention. And so your productivity tanks. And so the example I use is me sending you a 3-minute email to say, thank you so much for having me on this incredible Energy MD podcast is going to take 37 minutes because I have multiple screens open, multiple browser windows open. I'm getting distracted by text messages on my phone and everything feels like a code red emergency in my brain. I must take care of it now.
Hmm.
And so I lose focus on something that should be so simple, sending a thank you email.
So then you came up with the brain shift protocol. What is that?
Yeah. The brain shift protocol, I'll start with the science element and then we can break it down to actual steps for your listeners. We're in the global pandemic and I'm my travel as a chief wellness officer and professional speaker is halted. And I didn't know what to do with my free time, Evan. I was like, and so my CEO and his wife at the time, they were like, Romie, there is a uh thing called Netflix. Get a subscription. And Tiger King was trending back then. Did you ever get into the whole Tiger King
And
series?
didn't.
You saved your emotional well-being, right? I'm still traumatized thinking about it today. And I was like, this binge watching is depleting my energy and fueling a busy brain. I need something different. And I did what I know how to best do, and that's go back into research doctor mode. And I looked into the psychoneuroimmunoendocrinology literature. And I said, how could we fix the busy brain crisis without putting people on a diet? I am anti-diet as a chief wellness officer and brain doctor. And we'll dig into that in a second. And so I came up with the brain shift protocol, which is getting to the root cause of busy brain. There's 5 key areas that are affected. And the shift is an acronym for that. 1S is sleep or your circadian rhythm. 2H, hormones, specifically thyroid in men and women. I, markers of inflammation. And we look at things like fasting insulin levels, high sensitivity CRP, vitamin D3 levels. F, the food, how you fuel yourself without going on a diet. And T is the role of technology in adults' lives. And so that was the brain shift protocol we came up with, which was how could I as an individual help you, Evan, if you have a busy brain, help me, Romie, with a busy brain, knowing that our root cause may be a little different, but do this at scale because we were testing this protocol in groups of executives from different companies. So 1,000 people went through this protocol and allowed me to fine tune it along the way with their feedback and to come up with the 8-week protocol known as Brain Shift.
Very nice. So let's go
Mhm.
through each of these.
Yes.
So tell me about sleep. What are you
Mhm.
doing in sleep in the protocol?
In the protocol, so week 1 of the protocol, you take your busy brain test and you get your score. And step 2, week 2, we start you into the 7-day sleep challenge is what we call it, but it's really to reset your circadian rhythm. And it's based on cognitive behavioral therapy for insomnia. So I've saved people the $750 plus an hour to go to a specialist for this. And we broke it down all into behavioral protocol or brain shifts, easy, simple things to do, micro habits that can cause a massive change in your sleep. So one example in that protocol is really committing for 10 days to set a regular time to go to bed and wake up in the morning. And that's true even if somebody works second or third shift, right? I deal with complex workplaces that often have 24-hour cycles. So that's one thing. We also break down quick supplements for people to use. And I think the pro tip I would give here, Evan, and I think other experts have discussed it on your show before, but I'm going to repeat it as a neurologist, is please don't use melatonin. Prescription melatonin will actually fuel a lot of problems in the brain, the neuroinflammation, the downregulation of your brain's ability to make melatonin and disrupt your circadian rhythm even further. So we recommend 2 supplements there, magnesium glycinate and 5-HTP, which stands for 5-hydroxytryptophan, which is a precursor to serotonin, which will then naturally in the body break down to melatonin. So that alone, we see within 7 days, people are starting to restore that circadian rhythm and the rest, and they're feeling less anxious. And how that would show up when groups and companies were doing this, and even individuals, is HR leaders or leaders would be like, Romie, I don't know what's going on, but the people that typically come in my office complaining about every last change in policy, they're happy now. Or the teams that were bickering or colleagues not getting along, like there's collegiality on the team and everybody seems like a little happier and more productive. And it was just because we were resetting their circadian rhythm in simple ways. So that's sleep and what we start with. That also, then weeks 3 and 4, we bring in cognitive behavioral therapy techniques, specifically a brain dump that we designed, and digital detox. And a fascinating aside, before I became chief wellness officer, the research for this book started way back in 2017, and you and I are doing this podcast interview in 2024. That was when I first had the idea. And at that time, I was chief wellness officer at Evolution Hospitality. And I went to the CEO and said, I want to collect brain health and mental health data on 500 of your leaders. And we're going to ask them to do digital detox. And this is a company that's open 24 hours a day, 7 days a week. And we asked them to do one simple thing: shut down all digital devices 1 hour before bedtime. And you'll read the results in chapter 9, but they were astounding. That data now got carried through to my other speaking engagements to other industries. I can't tell you how many companies started to implement digital detox policies and saw great impact. And so that's what we ask people to do.
And so is that a separation from the phone? Is that what are the
Everything.
specifics? Okay,
30
interesting.
to 60, you set a bedtime, and 30 to 60 minutes before bedtime, no laptop, no phone, no e-reader, no Netflix binge watching on your smart TV or iPad either, right? And we actually give people resources or ideas of things to do that will help create rituals that's calming down your sight, your sound, your hearing, your aroma, your sense of smell, what you're tasting, and what you're touching. And an example is I leave my dirty dishes in my sink every night, every day. And so if my hands are all greasy and full of Dawn soap and I'm loading up the dishwasher, I won't pick up a phone or a laptop, even in the middle of a global book launch and taking a new position as chief wellness officer at another company. And then my dog, he's so cute, 17, and still lines up at the door, and he knows he's getting an extra walk at night. And so he's become a part of that nighttime ritual. And that's our calming down ritual at night. And we go out, and if it's a clear day, go, say goodnight to the moon together. And then we come back to bed. And that's digital detox. So, examples are taking a hot bath. The running water will calm your hearing, and the warm water will calm your sense of touch, right? And just the scenery of your bathtub versus the blue lights. So, yes.
So important. Yeah, it's just so easy to reach for something, reach for a supplement or reach for a prescription. But this reality that oftentimes all these things that we're doing during the day or into the evening are way too stimulating for us, where it's almost insurmountable to have a good night of sleep when you're being so stimulated. And it sounds like it's a combination of things, right? Sometimes if you're binging, like you said, the tiger, whoever that was, and like,
Tiger King.
right, I mean, your heart's gonna be jumping out of your chest, right? I mean, like,
Yes.
or if you have an argument with somebody in the evening, or yeah.
I mean, those are the obvious things, right? Like listening to the news or a crime podcast or something really awful like Tiger King. But here's the other thing, Evan, we know is even if people think they're scrolling TikTok or Instagram reels for cute videos of puppies hugging babies, that blue light is still stimulating you. Also, even if you're laughing at TV or something, that dopamine and adrenaline is now sending your brain into alert state instead of I need to rest state. And then when we're at the end of the day, when we really need to rest so our memory and emotions can, be processed by the brain, now we're at a heightened sense of alertness. And guess what happens? It's like a 10 times more likely that a negative thought is going to be coming up and haunting you in your sleep. And something that feels so awful, but so insignificant, like I forgot to have a hot cup of tea before this interview, or something really insignificant, and you're perseverating on it. That's a busy brain, the racing thoughts before bedtime.
Mm-hmm. And so I've seen some people with 5-HTP where even at like 50 milligrams, it can be too stimulating for them. What do you
Yeah.
think? What do you think's happening there?
That's a really interesting question. Some people, yes, 5-HTP and getting that serotonin boost can have a counter effect. And I'm blanking on the gene right now. I'm a little tired on the book tour and speaking tour. So forgive me, there's an actual gene that is tied to kind of this counter effect of, rather than the calming effect and the happy boost of serotonin, you're actually stimulating dopamine, adrenaline, epinephrine pathways and getting energized. That is a minority of people. Most people are sedated even at 50 to 100 milligrams. The one thing, we talk about in the book, and it's worth mentioning now because both Evan and I are board certified doctors, is please talk to your practitioner before you start this medication. And it should not be 5-HTP combined with an antidepressant drug, the SSRI drugs like Paxil, Prozac, SNRI drugs like Effexor, because you could get serotonin syndrome, and that too can cause emotional upset, tachycardia, and that. So, but it really, other than that, 5-HTP is a natural precursor of serotonin, and most people respond. If they're on that medication or have that negative impact with 5-HTP, we then use L-theanine. But across clinical studies, when we reviewed the medical literature on 5-HTP, we found that to be the most consistent studied supplement and natural thing to take to restore circadian rhythm as well as to help sleep at lower doses.
Mm-hmm.
Mm-hmm.
Excellent. And
Yeah.
then thyroid, lots of
Mm-hmm.
benefits. So this is the H for
The H.
hormones.
Yeah. I feel so strongly about talking about this one, Evan. And it's why I like candidly share my story, like the devastating news. I'm burnt out and I'm leaving medicine. And you'll read in chapter 4 of one of the patriarchy of medicine, kind of talking about how I work like a man and don't get pregnant, because the last woman they hired in the department was out for 6 months with her pregnancy and birth, and it ended up, costing the department money. And the irony was I was going through infertility. I was actually doing research at that time, Brian, on women's hormones in the brain for epilepsy and migraine. And I remember thinking, do I have a thyroid problem? My hair falls out in chunks, and I've never had a regular menstrual cycle in my entire life. And what did the doctors do? And as a doctor, I gave these male endocrinologists the power. They checked just a TSH and T3 and T4 and missed the rest of the panel, and missed my Hashimoto's thyroiditis or autoimmune thyroid disease or subclinical hypothyroid. And I was suffering busy brain and suffering, obviously, infertility. That was missed. And it wasn't until I found my path to integrative medicine and found my own integrative medicine doctor, and this all got diagnosed at age 39, that I finally had a regular menstrual cycle.
Wow.
And I share this because 1 in 8 women in the United States has an undiagnosed thyroid condition, either subclinical hypothyroid, your thyroid is low, or an autoimmune thyroid disease. But here's the thing I want to add, because I know you've had other podcasts cover thyroid. This is so important here as a brain doctor for me to say that 35 to 40% of people who have these thyroid problems, their only symptoms are psychiatric and neurological. Anxiety, can't focus, attention deficit disorder. And you're going to get labeled as a stressed out mom, working mom. You're just hormonal, but not get treated. And you may get put on a stimulant or an antidepressant or anti-anxiety drug, and nobody checked your full thyroid panels. So in chapter 16 of the book, we give the full lab slip to take to your primary care doctor. Evan, you and I practice differently now. You have such an amazing integrative functional medicine practice. Many of our colleagues, as you know, are concierge medicine. I work largely in corporate America, and I had to find lab slips that could be covered by traditional health insurance plans in the US. And so we include the full thyroid panel in that. And it's something so important. If that's the only takeaway anyone listening is getting, please go get that full thyroid lab checked. You'll read the story of Kelly in chapter 16, whose life got saved because she did these labs.
So how do the other hormones play into
Yeah.
the hormone section?
They do. As you well know, when we talk about a disruption in circadian rhythm with a busy brain, the hypothalamic pituitary adrenal axis is disturbed. And so, from the hypothalamus and pituitary, we get thyroid disturbance. You can, after that, absolutely get adrenal fatigue. For men, lower testosterone levels, and women, symptoms that mimic PCOS or perimenopause. I will say the seven is we include those labs, in the lab slips for men and women. However, my big focus in busy brain is to focus on the thyroid. If we screen and thyroid's okay, but a male patient has suboptimal testosterone levels or a woman has abnormal estrogen, progesterone, testosterone levels, we'll refer out. But literally, when it comes to symptoms of busy brain, we actually find most people didn't have a thyroid addressed. A man may be getting testosterone injections at a clinic, or a woman may have been given bioidentical hormones to help perimenopause or PCOS, but the thyroid was missed. And so, really, that's my big focus in this book because I'm actually just focused on those busy brain symptoms.
So are there more thyroid receptors in the brain than for the other hormones? What do you think it is that why there's so many, like why those symptoms of busy brain are so much associated with thyroid?
As we were doing the research, I don't know about thyroid hormones versus, because for a woman, the negative impact of withdrawing estrogen, progesterone from memory and estrogen, as you know, or a man, same thing for low testosterone levels.
Mhm.
What we know from the literature is when you're under chronic stress and burnout, that pituitary thyroid axis seems to be the one that's affected. And that if in chronic burnout, that we were showing in men, for instance, burned out and low testosterone levels, that fixing the testosterone levels were not enough. And if you go back and look at thyroid, it's beneficial, and same for women. And the same goes in some of the adrenal fatigue literature. We all know in integrative functional medicine, but a lot of the listeners that will be listening to your and I podcast in my community may not know this, is often people do these online quizzes of adrenal fatigue, and they get the supplements that are on one of our websites and they still don't feel better. And that's because, the upregulation, the thyroid controls all of the, downstream effects of what's happening with your adrenal gland and the sex hormones.
Yeah, I call the big three
Hmm.
adrenals, thyroid, and mitochondria because they really
Ah,
all
yes. Hmm.
work in concert.
Yeah.
S- So then so let's talk a little bit about inflammation. You mentioned some of
Mhm.
the labs. What is when you're testing for inflammation with people, because most humans have inflammation, right?
We do. Yeah.
And so what are you looking for in this section?
In this section, specifically for brain health, right? Because inflammation is important. Most of us have it, and it can cause different symptoms. But when I'm looking at busy brain, I wanted to look at a few things. One, global, looking at your high sensitivity C-reactive protein is a great indicator for brain and physical inflammation. But then we dug a little deeper. And the thing I wanted to look at was fasting insulin levels, hemoglobin A1C, and your fasting blood sugar. I think, some of my listeners may say, "What do you mean diabetes, Dr. Romie?" And we've talked about diabetes type 2 or 3, but there was something very interesting that we found in the medical literature as I was digging through this. Independent of all the pathology of metabolic syndrome and type 2 diabetes in the pancreas, is we have insulin receptors in the brain. And that when we eat high glycemic foods, such as white sugar, white flour, white rice, white potatoes, anything that spikes your blood sugar rapidly, it desensitizes the insulin receptors in the brain. Insulin is being used in the pancreas, and that can fuel insulin spikes and peaks and valleys in the brain, as well as with blood sugar, that actually fuels the inattentiveness, the inability to focus, and the ADHD symptoms. Here was the kicker with it, Evan, and this also goes into F food. If you combine caffeine and a high glycemic food, so with your afternoon caffeinated chai, in my culture, you're having a biscuit, or in the morning, you grabbed a donut or a bagel or croissant with your coffee or espresso. That actually impacted the cycle even worse
Mm.
and fueled this pattern of neuroinflammation, elevating interleukin 1 levels so that it would fuel more of this ADHD and rebound anxiety like symptoms. And so that's why in the protocol, we ask you pick one or the other, caffeine for a meal or a high glycemic carb, because I don't want to put people on a diet and this, if you're burned out and you have adrenal fatigue, people should not be on a low carb diet initially, right?
Right.
And I live in the real world and people are working long days and they may only have pasta to grab at lunch. Then we say, be mindful of the caffeine. What we found is most high performing individuals want to pick the caffeine and they naturally steer away from the high glycemic carbs and now are eating, healthier grains and low glycemic carbohydrates and doing better. So that's one aspect of inflammation we look at. The second inflammation point, if I'm not droning on too long and tell me we look at, is vitamin D3 levels.
And so what does that give you?
Yeah. So what we know, I'll backtrack to this. Vitamin D3, I started my neurology residency training. I'm aging myself in the 1990s. And do you know, even back then in neurology and psychiatry rotations, we would look at vitamin D3 levels in patients that were schizophrenic, had multiple sclerosis. We knew it was a risk factor and a problem. And even back then, I was like, why aren't we looking at vitamin D3 levels in healthy people then, And now we know this. And specifically, when we're under chronic stress and burnout, the metabolic pathways that may help to metabolize and the conversion of vitamin D from the sun, the precursors to vitamin D2 and D3 are blunted, from the skin to the liver and into the brain. Vitamin D3, I think, got a really bad marketing label. It's not just another vitamin. It is really the super pro hormone of the brain. That every hormone, 50 of them that cycle through the brain and the body to govern all of our organs, are dependent on a healthy vitamin D3 level.
Mm.
And the clinical literature, just being a traditional neurologist and psychiatrist, we knew if you had low vitamin D3 levels, you were prone to mood issues, depression, anxiety, difficulty focusing. If you dig into the ADHD literature in adults and in children, and we, break this down in chapters 7 and 8 of the book, we see people have a reduced attention span and more anxiety prone with low vitamin D3 levels. And so we need to check that and then restore it. So if there are just 2 labs people are going to get that would change the trajectory of busy brain, we ask for a full thyroid panel and vitamin D3 levels.
Very nice.
Mhm.
So let's talk about food. And you talked
Yes.
about being
Mhm.
anti-diet. What does
I
that mean?
am. It's not going to be a popular thing to say on your show and amongst our integrative and functional medicine doctors, because when I went through my board certification for integrative medicine, there was a diet or nutrition cleanse or protocol for almost everything under the sun. And I believe food is medicine, but I also believe that the diet culture in the West has 2 problems. It is toxic and creates more stress and guilt and shame and trauma in the brain psychologically. And 2, as a chief wellness officer, where I have to care for the well being of a culture of people that is inclusive, all of the diets that are in the West, and please find me one, if any listener or this, Evan, don't practice inclusion. I work in an environment where vegans and paleo and Ayurvedic loving and carbaholics and chocoholics and people who are just confused and intermittent fasting need to be able to all sit at one table at the company without being judged. And then, I use this example in the book. One of my comfort foods is lamb biryani. It reminds me of my maternal grandmother, her looking down on heaven from us today. And she was famous for her lamb biryani. When she would cook it, everybody in the alley would smell it and come to the door. There's so many joyful family memories. Comfort food is something that is anchored a core memory of joy. It can be tied to a family member, a religious holiday, your state or country of origin, your ancestry. Most of these foods, Evan, aren't accepted on the Western diet protocols. So now my brain is conflicted. There is
Mhm.
joy when I finally figured out, and the lamb biryani recipe is at the end of the book, along with so many other family comfort food recipes from loved ones. But my brain is conflicted because there's a part of my soul that is tied to an anchor memory of joy with the lamb biryani. And then there's a trauma track around food being built because my integrative medicine training has said bad, bad. Every ingredient in the lamb biryani is is inflammatory. You shouldn't be eating rice. You shouldn't be eating red meat. You shouldn't be eating the ghee. And that is what these diets are doing. So instead, on our protocol, we actually tell people schedule 1 to 2 comfort food meals a week. So if it is your child's birthday party, eat the cake so that your child sees you happy celebrating their birthday with them, if that's what you desire. Eat the lamb biryani. It's a religious, when you restore your circadian rhythm, you're no longer stress eating, which is somehow I went to the pantry and I wasn't even being mindful. And I opened a bag of cookies or potato chips, and the whole thing was gone while I was binge watching Netflix. I'm eating my feelings. That's the
Mhm.
difference. And that's really important. And we found massive success with this. And it's why people come to the protocol because I'm not putting them on a diet or cleanse. I also tell my integrative functional medicine colleagues like you, Evan, is this protocol will help the mind body connection and prime people to get ready if they do have a medical condition that you're treating. For instance, a lot of your patients with long COVID, they do need a specific nutrition protocol. We've primed them then to stop the stress eating so that for a temporary time they can follow a necessary protocol.
Yeah, and I think this kind of speaks to the mindfulness that you're cultivating in this program, the awareness that people have in their bodies. I feel like this is probably some of the most important work that I'm doing personally
Hmm.
right now is having that attention in my body as opposed to being so intellectual and in my brain, and being
Mm,
able to notice, as noticing being a
yeah.
superpower, being able to notice what those sensations are
Yeah.
and what's happening when I'm reaching for, something that's sweet, or why do I feel the need for those comfort foods?
Give me an example. So comfort food is not that stress eating, right? We delineated comfort foods are tied to memories of joy
Hmm.
or your culture or your religion, but stress eating is that. So what are symptoms you get? Because I think that's really helpful to people to know. Because you can hear the joy in my voice or see it on my face if you're watching YouTube of talking about my nani's lamb biryani, right?
Right.
But what happens when we go to the pantry? Because you and I both have done it. We're humans. And any listener listening has. What's the difference of that feeling?
So in general, I'll either be feeling some discomfort in my throat, or I'll
Mm,
be feeling it in my heart or in my
mm,
celiac plexus, like just
interesting.
below my chest. And especially the celiac plexus is kind of the place where I experience discomfort. And what ends up happening is that then I create a thought around it, or I think that, oh, I'm having this discomfort because I'm having this thought, instead of just sitting with the discomfort and being curious about it and thinking,
Mhm.
oh, wow, look, there's that
Yeah.
discomfort. What does it mean? It
Mhm.
may not mean anything, right? But
Yeah.
it puts me in a spot where I feel like I have to fix the discomfort that I'm feeling. And
Mhm.
that sometimes that means reaching for something. And oftentimes, my choices are better, but maybe it's like stevia and chocolate, or maybe
Mhm.
it's I don't know. There's these marshmallows that I like that are, don't have anything in them, so
Yay,
it,
marshmallows. Yes. I mean,
right.
yeah, and I get that. And so, yours is like a slowdown and a discomfort. Mine is a rev up busy brain.
Mhm.
I can feel the fluttering or the my achalasia symptoms and the tightness in my chest. And it's like this revving in my brain, a lightheadedness almost that like I swear if I was a cartoon character, you could see the circling thoughts in my brain at like a dirty speed going around and around. And I'm reaching for either salty or carbohydrate food to calm it down, right?
Mhm.
And using food to calm feelings rather than doing something else for that busy brain anxiety moment, which is typically go for a fast walk or run it out on a treadmill or something, like that. Or like the proper pranayama exercises for feeling anxiousness. And I think so. I love that we both are sharing these symptoms and it'll empower people when they are stressed and having a busy brain, not to go to the pantry and be with those feelings and do something about it other than food. The comfort food, like enjoy the foods with your loved ones that are sacred to a holiday or a family memory. Like that's so important. We shouldn't take that away.
Yeah, and I think making that distinction is important,
Hmm.
between the
Hmm.
stress eating and between the comfort foods.
Hmm.
For me, it's been really interesting with the comfort foods where my wife has a strong German background and grew up with like sugar on toast.
Interesting. Uh-huh.
Yeah, and it was like butter, sugar on toast. And for me, with my Jewish background, there's a lot of
Uh-huh.
kugels and like
Yes.
noodles and cheese
Yes.
and a number of these
Yeah.
things. So, what we've tried to do is recreate these for our daughter in a more healthy way, so we can
Interesting.
still
Yeah.
have the
Hmm.
that comfort food, but how do we do it in a way that feels better to our bodies and
Yeah.
so it's kind of like
Yeah.
it's meeting in the
It's
middle,
great. And
essentially.
that's a great way to do it, but I'm going to be real with you, brother. There ain't no way to do that to lamb biryani without like destroying the memory of my grandmother or the taste of the biryani. And
Yeah.
then nobody is going to be knocking on my door to join me for dinner if I tried to do a healthier version, you know?
So then, yeah, I think I absolutely agree. I think that the stress that comes from trying to eat a certain way, oftentimes people are like, hey, it's too stressful for me. Or when they come into my programs are 12 months long to get
Yeah.
rid of, chronic fatigue and all that. And if they can't, they're like, I'm too stressed right now to deal with the food stuff. I was like, don't worry about it.
Yeah,
We'll come back
absolutely.
to it when you're able
Yeah.
to, but we don't
Yeah.
want it to be another stressor for folks.
When I was still seeing patients in the integrative medicine clinic, we took care of a lot of elite performing athletes and professional athletes, executives, people who were already doing paleo or keto or whatever to perfection, and they were still really suffering busy brain. And so I could see sometimes that strict protocol was fueling the stress hormone levels. And here's a
Mm.
fun fact. I gave the keynote lecture and was talking about my research at the American Counseling Association in 2023. It is the only time as a speaker I've gotten a standing ovation in the middle of my keynote
Whoa.
was when I said diets, is a four-letter word and we need to stop prescribing them. And every therapist agreed because we know the guilt and the shame and the trauma that can come from restrictive dieting. And, again, like a lot of your patients, Evan, are in a different place. Like it is. I think of a lot of, I remember my, chronic digestive issues, inflammatory bowel disease patients, like we had to put them on protocols, right? And there was immediate relief that they felt. So it wasn't stressful. It was because they had relief in their digestive system that it was not bad, right? But for most people, when you look at the psychology literature, it actually can increase stress hormone levels.
Yeah, I think that's a really important point because really is the summation of all of these tiny stressors.
Mhm.
It's like
Yeah.
every single decision that you have to make or every single notification you get on your phone is probably increasing our stress hormones a little bit. And then you get too stimulated and then you can't go to bed. So it's kind
Yeah.
of all leading towards that.
Yeah. Yeah.
Mm, so good. Um, so we just need to throw out our phones. Do you think that's a solution?
No, because then I sound like a cranky Indian auntie. No phone. Let's go back to the rotary phone. And you hear enough of the judgmental Indian aunties in my brain. We can't do that. I live in the real world. You live in the real world. And, you know, um, business and connection with loved ones is done by the phone. But what we have to realize is happening every time a phone or a laptop or an iPad we touch the screen, it's stimulating the dopamine reward network. And we get this temporary high, like you had a hit of crack or cocaine, or gambling. And then it wears off and you go into a valley and that FOMO kicks in. Oh my God, did I miss a work email? Oh, I haven't checked my Instagram in 37 seconds. Like that repetitive thing goes on. Or same thing with work emails. The kind of clients you and I deal with is let me just knock out 2 work emails before bed and I'll feel better. And guess what? The bad news is there's always 17 more that pop up, and it's a never ending cycle. And so it's that addiction of control or FOMO of missing out. And when you can break that, there is peace.
So I would imagine, some of this is mindfulness, some of this is mindset. And so you talked a little bit about the
And science
CBT.
and neuroscience. I mean, let's be real. There's all neuroscience in there, and it is really just broken down. So, uh, this was kind of like, remember I started, nobody wants to be told to eat berries and breathe and shift a mindset. Like, this is hardcore science that we've dug into what is actually happening to neurotransmitters and the structure and function of your brain with this. So it is. So yes, this is behavioral change, or brain shifts are known as micro habits. So based in psychology, absolutely.
So is there a mindset practice
Mhm.
that is part of this whole protocol that you advocate?
Yeah. In chapter 10, or week 1 of the protocol, I call it the 3 evil cousins of your brain, you know, uh, projection, denial, and resistance.
Mm.
And so you take the busy brain test and you will project of, "Ugh, this is just Romie or Evan and, their problems on me, or their ideas." You may resist it and say, I don't need to do this, or, we may be in denial, whatever that is. And, we actually give you exercises to work through it and look for one particular win that you will feel 8 weeks later. You repeat the busy brain test and people see a drop in at least 25% or an improvement in the score. But an example I give in the book and I'll give now is, I'm humble with you. I'm in a multi-city speaking press tour now as you and I are recording this podcast. And I'm on a lot of planes and sitting in a lot of chairs and rushing around. And even while I'm following my protocol, the stress is starting to happen in my neck and my shoulders. And I would say, 8 weeks from now, I want relief of my neck and my shoulder pain. And that's an example. Or people will say, I want my acid reflux or my blood pressure to be better, or my blood sugars. And that's the mindset we do. And then the other piece is these brain shifts. We're just asking you to do 1 or 2 small micro habits that won't interfere in your day-to-day life as a busy working adult, as a parent, as a caregiver to elderly. And those are the 2 mindset things that we recommend.
Brilliant. Well, Romy, this has been great.
Thank you, Evan.
We're going to drop the links below. So I recommend that everybody go and check out the Busy Brain Test
Yes,
and get the book. I'm excited to read the book.
I'm the same with you.
I'm
Thank
really
you.
excited. Yeah, I think it's going to be really valuable for me, the work that I do, and on my own personal growth. So thank you so
I'm
much
honored.
for sharing everything today. Any last words that you want to share with our audience before we adjourn?
For anybody that listened to the top of this interview with Evan and I, if you're feeling alone, I just want you to say something that I wish someone had said to me when they were wheeling me into surgery, is that your brain is not broken. Your mind is not a mess, and hope did not depart your soul. We're here, both Evan and I, to help you brain shift.
Brilliant. Thanks for being here today.
Thank you.
So if you have chronic fatigue, long COVID, or mast cell activation syndrome, and you're looking for help, check us out at energymdmethod.com. We have a program for almost every single budget, and we're here to help. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.